All right. So his Great Society program, I would say, is a good thing, but it definitely, it's kind of like the New Deal in the essence that, the New Deal, you know, has its pros, has its cons, but he gets a lot of credit for the New Deal. I don't know the answer to that question. Bliard, you got to ask your other teachers at that point. We haven't had a full discussion with our admin yet, but obviously the news has come out, so we're kind of like at a little bit of like shrugging our shoulders, like what to tell you guys. So just be patient with the whole thing, I guess. Once I talk to Ms. Reed and Mr. Martinez, we'll see what the plan is. Okay. But Lyndon B. Johnson takes over after JFK is assassinated. He was John F. Kennedy's vice president. We're going to go away from the conspiracy that he was responsible for JFK's murder and just kind of go with the traditional view. He said all the right things after the assassination. In fact, one of his most famous sayings is, "I'm just doing what Jack did." Okay, I'm just doing what Jack wanted to do, sort of thing. And basically, Jack was the nickname for John F. Kennedy, and he really tried to follow in John F. Kennedy's footsteps in a lot of the things, specifically the Civil Rights Act and the Voting Rights Act. And the Great Society program we'll take a look at today. The bad things he's known for are, of course, the Vietnam War. We're spending all of Monday and a good chunk of Tuesday with the double period on Monday and then some of Tuesday looking at the Vietnam War. The Vietnam War, I'm just telling you right now, it's really the only war that we ever lose. We'll talk about how and why we lose it. And obviously, the Vietnam War is going on for all of Lyndon B. Johnson's presidency, and he makes some pretty, not so good decisions, throughout his presidency that kind of makes some people believe he did a bad job. All right, but every president does some good, does some bad. Hopefully you realize that in this class. We're going to look at that a lot over the last few weeks of this course. All right, this is the one slide for today you need to copy down. Then we have a reading I want to do together, and then you'll fill in a graphic organizer, and that's pretty much it. I think a lot of you will finish early. So take a minute and copy this down. Okay, so let's go through some situations. I often go back and forth. Do I throw this when we're going over civil rights? Because we kind of went back to the Cold War. This really doesn't have much to do with the Cold War. I don't really know where to fit this in. Essentially, he's going to, some people call this New Deal Part 2. And essentially, it's a bunch of government programs that are created. Lyndon B. Johnson, no, he wasn't assassinated. He just left office. So I see something quick here. Yep, okay, got it. Just wanted to see something. All right, so Johnson declared a war on poverty. And even though our country is not going really through any economic turmoil, in fact, they're doing quite well economically in the 1960s, we still have a large chunk of people that are poor. This has been just a fact of reality, especially in a capitalist society. You're going to have poor people, you're going to have rich people, you're going to have a lot of people in between. And the goal in a capitalist society is to, not close the gap between the rich and the poor, so to speak, but to, try and bring up the poor and try and not have them poor. So he's going to focus on trying to help out the poor people. He feels as if even after the New Deal, a lot of people that are poor are not really looked after, and he wants to change that. So there's going to be a lot of laws that are going to be passed through Congress to help out the poor, and it's going to be through his Great Society program. Okay, and let's talk about why it was a little controversial at the time. We used the New Deal when we were in the Great Depression to help get us out of the Great Depression. A lot of people were skeptical of the Great Society program because economically we really weren't having much issue in the 60s. Yes, there were poor people, but that's sometimes a reality of a country. There's going to be people who are poor and struggling, and it's important to try and help those people out. But to put in a program as big as the Great Society, as this is called, people were a little skeptical of that. He passed some very famous laws and new programs that were designed at this time. The most famous are Medicare, Medicaid, the Department of Housing. Those are probably the biggest three. Okay. And we'll talk about, generally, what these were when we get to the reading a little bit. All right. The government takes more of an active role than they did even through the New Deal. So now you have the New Deal programs. Now you're adding about 50 more programs and laws that are going to be trying to help out people that are poor in this war on poverty, and is trying to help these people out. Healthcare, getting healthcare to people specifically who are poor, and housing are the two main focuses, because there's a huge homeless problem within the United States, and a lot of people who are poor can't afford healthcare. All right, and it starts getting into the question if healthcare should be a human rights sort of thing, which is a debated thing. And ultimately, he wants to try and give people the opportunity, whether they're poor or elderly, to have the ability to get healthcare. Well, Ismail, let's look at the reading first, and we'll look at the difference between the two, because they are confusing because they sound similar, and they are kind of similar, but they do have some differences that go alongside it. All right. So let's go into the reading now. Hopefully now everything is copied down. If you need more time, just please write in the chat. Otherwise, I'm going to move on. I'll take your silence as we're good to go. Okay. So let's do the reading. It's a little long, but let's go through it together. I'll read it, and I'll just stop and talk about a couple things, because like the New Deal, there's a lot of programs, but only a couple of which you really need to be familiar with. The Great Society program, you just really need to be familiar with like 2 or 3 for the regions. With the New Deal, it needed to be a lot more. But let's take a look. Lyndon Baines Johnson became president after the assassination of President Kennedy in 1963. Johnson used the wave of sympathy and public support to pass a number of Kennedy administration proposals, including the Civil Rights Act of 1964. So that's what we talked about. He was just doing what John Kennedy wanted, sort of thing. And John Kennedy, when he passed away, became a very popular president, as it usually happens when someone gets assassinated. So they just try to follow in his footsteps a little bit. Building on this momentum, Johnson introduced his own vision for America, the Great Society, in which America ended poverty, promoted equality, improved education, rejuvenated cities, and protected the environment. This became the blueprint for the most far-reaching agenda of domestic or at-home legislation since the New Deal, legislation that has had a profound effect on American society. Perhaps driven by his own humble beginnings, Johnson declared a war on poverty essential to building the Great Society. In 1960, despite the prosperity of the times, almost 1/4 of all American families were living below the poverty line. Okay, so it's like 25%. And entire regions of the country, like Central Appalachia, which is like the South, the southern states a little bit, were bypassed by the economic growth of post-war years. Moreover, technological advances in industry were also changing job requirements for American workers. The good-paying, unskilled jobs of the past were disappearing, and those without education and skills were being far left behind. So when you get to the assignment eventually, there's going to be a lot of programs that you're going to have to write down and tell us what it's about. So if you don't fully remember this from the reading right now, it's okay. You're going to come back to this, but just kind of get a sense of what some of these programs were. The first piece of Great Society legislation, the Economic Opportunity Act, or the EOA, in 1964, tried to give people tools to get out of poverty. First, the bill created the Volunteer in Service to America, which is known as VISTA. VISTA volunteers worked in poor communities throughout America in areas of education, agriculture, and other community programs. The EOA also created the first Job Corps, which trained young people from background skills to get good jobs. Okay, so if they're young, you want to get into a specific job field, you can go into the Job Corps to kind of guide you into there. So if at the age of 14, you want to be an industrial worker, you can go to the Job Corps. If you want to be a doctor, you can go to the Job Corps. They can get you a program designed to help out. The EOA also created a preschool program to prepare children for success in public school called the Head Start program. Now, Head Start, I'm not sure if you guys have heard of this, it still exists today. This is not required, but just kind of encouraging more people to enter school prior to kindergarten. So things like nursery school or pre-K, you can go through the Head Start program. That's a program designed by the government and usually free to people who go. All right. Before this, if you wanted to go to nursery school or pre-K, you pretty much had to pay to go, which obviously, if you were poor, was a lot tougher to do. The bill also funded community action programs and extended loans to small business and farmers. Johnson's landslide re-election victory over Republican opponent Barry Goldwater in 1964 added to the momentum of Great Society reforms. Over the next 4 years, Johnson enacted a flurry of legislation. One of the most ambitious efforts was the establishment of Medicare to provide health care for America's senior citizens. Okay? In 1964, 44% of seniors had no health care coverage. And with the medical bills that came with older age, this propelled many seniors into poverty. So let me explain something. I'm going to prove this to you shortly. When you have a job, it's very generally easy to get health care because if you have a career or a job, your employer, the place you work for, is going to provide that health care for you, usually for free. Sometimes, like Mr. Pani, I'll show you, I pay for my own health care. I want a little bit of a better coverage sort of thing. But if you don't have a job, you don't have health care. Okay, you have to buy it yourself. And if you don't have a job, it's really, really expensive. So it's tough to do. Okay, when you retire, there's a little bit of a problem. Even though you collect Social Security, you don't have health care coverage. And you guys, I'm sure, understand, have grandparents and understand a little bit elderly people get sick a little bit more often than, 25, 30-year-olds. All right, so not having health care coverage can get very expensive very quickly. In fact, more than 1 in 3 Americans over 65 were living below the poverty line, which is the opposite. If you worked your whole life, you want to be, enjoying your retirement, enjoying your final years of life. All right, not poor. More than double the rate of those under 65. With the creation of Medicare, virtually all seniors now have health care, and the poverty rate for the elderly have fallen to approximately 1 in 10, a rate lower than that of the general population. Along with Medicare, the Johnson administration established Medicaid program to provide health care to the poor. So, Lizmel, to answer your question, they both are responsible for medicine and health care. That's the word Medi. Medicare is specifically for the elderly. Medicaid is specifically for people who are poor and maybe don't have a job and can't afford their own health insurance. It's a government option for health care. Okay? Let's keep it going. Education reform was also important of Johnson's Great Society. In 1964, 8 million American adults had not finished 5 years in school. More than 20 million had not finished 8 years as well. And almost a quarter of the nation's population, around 54 million, hadn't finished high school. So a lot of people aren't finishing school. In 1965, Congress passed the groundbreaking Elementary and Secondary Education Act, which for the first time provided federal funding for education below college level, passed the Higher Education Act, which created a National Teacher Corps and provided financial assistance to students wishing to attend college. Okay, so prior to 1964, the federal government did not have really any say in education. Okay, they're all designed by the states, and some states did well, some states didn't do well. After this law, the federal government has more of a say within education. This is an implied power. They use the Constitution, the Elastic Clause, to basically get this through. Now, something really weird really happens, which is a little bit of a surprise. I just feel like I have to mention. Prior to 1970, we were rated #1 education system in the world, prior to 1975. After 1975, we have taken a little bit of a tumble. And a lot of people would argue that's because maybe the federal government tried to take more control and tried to make it more of a country-based and federal thing, as opposed to letting the states handle it. And maybe that's a reason why we took a tumble. I have no evidence to back that up. I'm just saying that's an argument that some people make because we're not #1 in education anymore. I don't even think we're in the top 10. So ultimately, something went wrong from 1975 to now, and this may be one of those reasons. All right. Urban renewal, okay, city renewal, and conservation was a third major component of the Great Society. Ever since the end of World War II, cities faced a shortage of good, affordable housing. At the same time, the suburbanization of America, along with the changing economy, meant that many businesses began to leave city centers an exodus that was accelerated by urban rioting that began in earnest after the Watch riot in 1965 in Los Angeles and continued throughout Johnson's term. You'll learn about on Tuesday there was a lot of unhappiness in the country with the Vietnam War, and that led to some violent riots that caused some changes in cities. So a lot of people moved out of the cities and into the suburbs. As a part of the response, Johnson signed the Housing and Urban Development Act of 1965 that established the Department of Housing and Urban Development, or we know it as HUD, and expanded funding for public housing. In addition, he provided aid to cities to rebuild blighted areas. So if there's an area around the country that's struggling, they try and develop, or there's a lot of homelessness, I should say, they're going to try and create a public housing program called public housing. Okay, sometimes it's sometimes known as the projects. I'm sure you guys have heard of that. I know PS 89 is located close to some of the public housing developments. And the quality of the housing in HUD isn't great, but it's better than being homeless sort of thing. So this is a government program that's designed. The war in Vietnam limited Johnson's ambitions for a great society. The cost of the war in Vietnam, along with the cost of the Great Society program, strained the economy. Moreover, as the war became more and more unpopular, you'll learn about this next week, Johnson lost the political support needed to continue these reforms. Critics of the Great Society also charged that these reforms just created bureaucracies and threw money at problems without producing results. So that's kind of like the education thing. We created this government program for education, yet our numbers got worse, which is left a lot of people frustrated. Public housing was created, but the houses weren't that great. Okay, it's like we put all this money in and it wasn't really making this huge impact. Still, others rejected the notion that the federal government should be undertaking these tasks at all. Nevertheless, the impact of the Great Society in many areas is undisputed, as political leaders today still wrestle with how to deal with these issues of poverty, healthcare, and education. Okay, so we have a lot of programs here. We have a lot of things, but ultimately what has happened is the government has gotten bigger in terms of how they try and help out people, and those have their pros and cons. Okay, it sounds, perfectly good that, hey, the government's getting more involved in trying to help out people in need, and that's a good thing, of course, in theory, but there are some negatives that come with it that you need to be aware of. The first of which, there's usually a correlation. Let me ask you something. When the government takes on more things like healthcare, like housing, like education, what happens to people's tax dollars generally? What happens to the debt? Okay, it goes up, they raise. Okay, so this is obviously just one of those times we're going to look at, again, we did this we looked at this when we did the New Deal. We're going to do it again now, but if you just take a look here, I want to show you a couple things. All right, so after 1965, all right, you've seen my paychecks before. This is nothing new. If you look at the arrow that I'm pointing to here, every 2 weeks, I have to pay something like $40 to Medicare. Okay, not that big of a deal. I don't really mind paying it, but you see, it kind of ends up. So that money is going into our Medicare program, and that money is designed to help elderly, okay, people who need health insurance. Okay, along with Medicare, it's also going to go to Medicaid. Okay, so even though it just says Medicare, it's really Medicare and Medicaid. That money is coming out of my paycheck and going to help out those people. Okay, I don't really have a choice. Okay, where this becomes a little bit controversial is if you see my second arrow here. Now, most teachers at PS 89 have a health insurance through throughout the Department of Education. So a lot of their health insurances are free. Okay, now it kind of works like this. The more money you pay for healthcare, and the better health coverage you get. All right, so I have a condition where I really need good health insurance, so I tend to pay for better health insurance. Okay, even if you have Medicare, you're getting it for free. Like if I chose to get Medicare, I'm getting it for free. But just to be honest, like the health coverage isn't great. It's very, very tough to have excellent health insurance that's cheap and affordable and that everyone can have. It's just very tough. So if you want better health insurance, you have to kind of pay a little bit more money sometimes. Okay, certain jobs, like my dad works in a hospital. My dad has excellent health insurance because his job provides excellent health insurance. So as you guys get older, it's sometimes not only doing jobs that you want and jobs that pay well, it's maybe jobs that have good health insurance for you and your family. All right. because otherwise you have to go to like Medicare or Medicaid if you're a younger person, and the quality is just not as good. All right, and obviously your health is very important. All right, so not a lot, but $40 a month. That's just another thing that's coming out of my paycheck. You already saw the Social Security. You already see the federal tax, the state tax. So these are the things. The more government programs there are. If you take a look at our debt calculator, okay, we're $28 trillion in debt and going up. As you can tell here, look at the largest budget items. What is the most expensive thing to the American taxpayers and to the American government right now? What is the most expensive thing for people? Correct. Medicare, Medicaid. It's even more expensive than Social Security. It's even more money than we put into our military. It's even more money than student loans. It is our most expensive thing. Now, health insurance is important. People, if they get sick, they should be covered and shouldn't really have to pay money, okay? But it's expensive. It's very, very expensive, and you can kind of tell that here. When this started, let's go back to 1980. All right. The largest budget items used to be Social Security. That was 114 million. Medicare was only 52. Okay. But what happens? We have more people getting older. We have more people that are going on Medicaid. So it becomes a lot more expensive. Okay. So just coming back here to 2021. All right. We see it's our largest budgeted item. So this gets very expensive. And this is why some people aren't the biggest fans of Medicare, Medicaid, because of the cost of it. Okay. And if you look at someone like me, who I'm paying for Medicare, Medicaid, but I'm also paying for my own health insurance. So it's like I'm almost paying for health insurance twice, even though I'm only getting one. The health insurance is for other people. And, that's where I guess the kind of controversy comes in. Let's take a look at this. We've seen questions like this with Social Security, but let's try it now for Medicare and Medicaid. It's kind of the same thing. So you have a chart here of the age where people are retiring. Okay, in 1950, it was like the age 67, but people were only living to the age 65. So really, on average, no one's really spending much time in retirement. Look at 2005. People are average 62, but are living to be around 75. Right now, it's like the average retirement age is 62. People are living to 82. I could probably get a more updated chart up there, but it just kind of goes to show you people are spending 15, 20 years onto their retirement. That means they're spending 15, 20 years with the Social Security paychecks and 15 to 20 years on Medicare. Okay? So as the average age of the nation's population increases, there will be a need to what? To, okay, address the financing needs of Medicare. In just 30 years, we've owed another $600 billion in Medicare. So we need to do something, like I said, with Social Security, either raise the retirement age where people can get Medicare, or put less money in, whatever it is. It's a bubble that's waiting to burst at some point. All right. Let's try these. President Lyndon Johnson's Great Society program was aimed at reducing the social pressures caused by what? One is correct. Poverty and urban deterioration. Urban deterioration means that the cities are dying out. One way in which the New Deal and the Great Society are similar is that both programs are based on the belief that what? Okay, 4. And hey, you can't blame people for thinking like that, to want to help out people in need, but there comes a point in time where you're almost helping too much. As a teacher, I try and find the fine line of like helping you guys out a lot, or, letting some things go and having you learn on your own. So it's a tough thing. It's a tricky thing when you're in government to have the perfect amount of help for citizens that are in need. Too much is not good. Too little is not good. And it's a tough fine line to figure out what's best. All right. So you got about 18 minutes here. You've done the reading now. Now you're going to go back to the reading and you're going to fill in this graphic organizer. Okay, very simple thing. Okay, you have VISTA, the Job Corps, Head Start, Medicare, Medicaid, and HUD, and the Elementary and Secondary Act. Okay, so first off, you got to tell me, who is it designed for? What group of people? Don't just tell me Americans. Obviously the Americans. Okay, but What was Vista? What was that group trying to help? Medicare, what group is that trying to help? Describe what their program was. I would say the best way to do it is this. Take one sentence from the text, one sentence in your own words that describes it, and then that should be fine. All right, and then just tell me what issue it addressed, okay? Was it trying to help out the poor? Was it trying to help out the education? Was it trying to help out people with healthcare, okay? Pretty much that's what you're working on. I think most of you will get close to finishing. If you're not, then you just got to finish it up for homework. All right. Any final questions before I take attendance and leave you be? I think it should be a pretty straightforward assignment. Okay. So we have double period Monday on Monday. So I'll remind you some things at the end of the period, but you guys are working on this for now. Let me know if you need me.